Hi, welcome back to our channel. This is Dr. Khawaja with our first installment of Clinical Insights with Dr. Khawaja. Have you ever wondered whether your mental health treatment is working for you? Maybe you've tried different medications, maybe you've tried therapy or other treatment options like TMS and have not noticed significant improvement or the type of improvement you would love to have. If this sounds familiar, you're not alone. There are other treatment options. Let's discuss the indicators which show that things are not working as they should be. Number one could be that you are not noticing any improvement in your symptoms. You've been on the medications or in therapy, but your symptoms are still bothering you. The other indication could be that yes, you may have noticed some improvement in the beginning, but then your improvement plateaued, and then there's not much improvement after that. Third, that you are feeling better, your symptoms are under control, but your functioning has not gone back to the level where it should be, where you should be able to enjoy your life, be able to function in your job or in school. I want to emphasize that you should work with your provider as a collaborator. You should be asking questions, be prepared, and be engaged in your treatment. And sometimes it may not be possible if you are really depressed, but be aware that your provider is there to work with you, not just to give you a prescription or prescribe any therapy. There could be things, for example, a person could be misdiagnosed, and unless you are engaged and talking and asking questions of your provider, it may not be picked up. Other reasons could be that maybe you are on a wrong medication. Now, a lot of times people are in therapy, but they may not be on the right therapy for the right kind of a problem because therapy is not fit for all. Several types of therapies work for several diagnoses or several situations rather than this therapy will work for everybody. I want to emphasize that mental health treatment is not one size fits all. One treatment which works for one person may not work for the other person, but still you have to be engaged in asking questions. Think of it as an ongoing process because even diagnosis could change. A person might have been diagnosed with major depressive disorder, and it may turn out that they may have bipolar type 1 or bipolar type 2, which would make the treatment totally different in terms of medication or other options. So, what are the other options? Medications, maybe on medications, but it may not be the right medication. Each diagnosis disorder may have medications indicated for it, FDA approved for it, but sometimes people need different combination of medications. Medications is a very commonly used treatment option, but not every medication is appropriate for every diagnosis or may not be suitable for each patient. Asking that question whether this is the right medication is a very legitimate question. Other options include transcranial magnetic stimulation, specifically for disorders like depression, severe depression, and OCD. This is not approved for schizophrenia or bipolar disorder yet. So, what exactly does this TMS do for a patient? TMS, as it sounds, transcranial magnetic stimulation, which means that we are giving magnetic stimulation to the brain, certain parts of the brain which are having some problems in certain disorders. For example, in depression, that portion is the left dorsoprefrontal cortex area, which is the left front side of the brain, where there is decreased activity, where when we use transcranial magnetic stimulation, it activates that area and people feel much better. The symptoms of depression go away. In general, it is very safe as well as non-invasive treatment where there is no downtime. A person may come, takes 15 to 20 minutes, sometimes maybe more, but in general, less than 15 minutes. They get their treatment, they get up, they can go back, drive their car, go back home. So there's minimal downtime. However, they have to get the treatment at least 3 to 5 times a week. And sometimes they can get boosters as well. There are different protocols which are now approved where we can give more than one treatments within the same day. People usually see benefits after 10 to 15 treatments, and they notice improvement in their sleep, their energy level, as well as overall well-being. What about other options like Spravato or esketamine? Spravato or esketamine is approved for treatment-resistant depression, meaning that patients who have not responded to antidepressants, they get that treatment, and a lot of times they get so much better within first or two sessions. However, with Spravato or esketamine, patients have to be in the office twice a week for at least 2 hours, where they get that treatment intranasally. They actually take it by themselves, and we monitor them for 2 hours, watching for their blood pressure. Now, once the treatment is done, they're not supposed to drive back home by themselves. Somebody should take them back home, and they should not drive the rest of the day until the next day. However, they still need to be on medications in general while they're getting TMS or Spravato treatment. Now, we've discussed TMS, we've discussed Spravato. What about psychotherapy? A lot of people, when we see patients who've been in therapy for years and therapy hasn't made much of a change. What do we say about that? Now, therapy in general is very effective, but it matters whether this is the right kind of therapy for your particular situation or your particular diagnosis. So that's why it's important to be really aware of what your diagnosis is, or if it has been changing, or what your circumstances are. For example, patients who may have borderline personality disorder, there are certain forms of therapies like dialectical behavioral therapy which works better than just supportive therapy or just talk therapy. So you might want to be aware of what therapy you're getting. Ask your therapist about what are the elements or what modalities the therapist is using. For example, some people may use cognitive behavioral therapy or EMDR. These are different forms of therapy meant which are supposed to be helpful for different kinds of patients. So it's important to understand why you're getting therapy, for what reason, and whether it's working or not. One should not be getting therapy for the rest of their life without seeing much improvement. One form of therapy which we do not offer in our practice is ECT, or electroshock therapy, which is a very important therapy treatment for patients who have severe depression or even other forms of illnesses like bipolar disorder. For ECT and electric shock therapy, a person is actually given a seizure while they are unconscious. So that's why it is usually done in places like hospitals where there are anesthesiology services available. Now, seizure is induced, and that is therapeutic in those cases. Without the seizure, patients do not improve in those cases. It is not very commonly used nowadays because there are other treatment options which are less invasive, like TMS or Spravato. But still, it is considered as one of the best forms of treatment for patients who have tried all different forms of options and are still depressed. Having so many options, how do you know what treatment is going to be beneficial for you? Now, that's a very complex question, and I can't answer it for you. And usually, it has to be done in an evaluation setting or a consultation setting where a patient sees a psychiatrist or a provider and understands what's going on, comes up with a diagnosis, and based on the diagnosis, one could formulate a treatment plan. Though it doesn't mean that you have to formulate a treatment plan just once and that's done, because it's an ongoing process. As I said, sometimes the diagnosis in mental health is not permanent, it could be something which evolves over time. There are so many other factors which are involved. For example, diagnosis, as I mentioned, but also what treatments they have tried before. In addition, certain medical conditions would bar somebody from trying certain forms of treatment or certain forms of medications. So, in short, you really need to work with your provider closely, ask them questions, talk to them, be open, and explain what symptoms you have or how you feel so that your psychiatrist could really get to know you and diagnose you properly. Because sometimes we say that a really diagnosis well formulated is half the treatment. Always talk to your psychiatrist and your provider about other options. For example, in mental health, medication, TMS, they are not just the treatment. There are other aspects, including your lifestyle, managing stress. We talked about psychotherapy. So there's so many different factors which goes into creating a treatment plan. Therefore, you gotta be open about your life situation with your psychiatrist, your provider, so that they can understand your situation and give you the right option. It's really important that you go over your go over with your provider what are the treatment options, and that would enable you to really talk about your life. Now, I can understand that sometimes people are not that comfortable, but at least be open about your symptoms, how you feel. And then, if you are in an environment where your provider is non judgmental, really caring and listening, you would feel more and more comfortable with each and every visit. Now, I want to end by saying that mental health treatment is a journey. It's a process, it takes time. You got to be involved, take ownership of your mental health, just like other areas of your life. For any questions you have, please leave comments in the comment section. And for more information like this, please subscribe to our channel. Thank you.